Hello, everybody. My name is John Vokel. I'm an MBA student at Northwood University. I'm also the first place winner of the 2019-2021 or 2020 Bowervic essay competition. A quick housekeeping item before we get started is that on the right side of the screen, there's a Q&A box. I will be keeping an eye on that through the discussion. And in the last 10 to 15 minutes, I'll be referring back to that to ask our panelists some of the questions that you have. Without further ado, I'm going to go ahead and introduce our two panelists. First, we have Dr. Dale Matchek. Dr. Matchek is a professor and a chair of the economics department here at Northwood University. He earned his undergraduate degree from the University of Michigan and his doctorate degree from Cornell University. He is also the academic director of Northwood University's Freedom Seminar, and he is a co-author of When We Are Free, which is an anthology of essays compiled to really drive home Northwood's core philosophies about free enterprise. We also have Mr. Michael Lefebvre. Mr. Lefebvre is a senior director of the Morey Fiscal Policy Initiative with the Mackinac Center for Public Policy, where he has worked for the past 25 years. He is the author or co-author of 23 studies on subjects as varied from cigarette smuggling, the state budget, school finance, the state economic department programs. His most recent study, Economic Development, State Handouts and Jobs, A New Look at the Evidence, analyzed the impact of government subsidies on roughly 2,000 state incentive deals going back to 1982. In addition to his work at the Mackinac Center, Mr. Lefebvre taught economic history and the economics of public policy at Northwood University in 2001 and 2002. He holds undergraduate and graduate degrees in economics from Central Michigan University. But I'd like to thank you both for joining me today. And Dr. Matchek, in respect to the fact that you joined us for the last panel, I'm going to go and get the webinar started with a question directed to you. So this being the second webinar that you've done for us, I just would like you to kind of recap some of the things that we talked about for the first webinar and briefly touch on some of the points that were discussed that night.
Well, thank you, Jonathan. I thank you for inviting me back. I hope that means that I added some value to the first webinar. And at that first webinar, we actually had three panelists, and we talked about the effect of the lockdowns on entrepreneurship. We also covered some of the ground on how to think about it. Like an economist, and I mentioned some of the economic studies that have been done. It's really hard to distinguish between the effects of personal voluntary choices to social distance and the effects of the lockdowns. So that's going to be one of the problems. Although some economists have been able to tease out that data using Google mobility data and otherwise. And what they discovered was that the lockdowns did not actually have that much effect on people's behavior. It did have, however, a very significant effect on unemployment. And so it's a challenge for economists, but there's a lot of information. Most of it that I have read suggests that the lockdowns did not add much in terms of making us safer compared to a lot of the costs they imposed on the economy. So I might go back and review some of those findings tonight, but I think those are the two of the main points. I also wanted to emphasize the fact last time that this recession has some long-term consequences. Some of those are due to COVID and are unavoidable. Some of those are due to our policy response and very avoidable and regrettable. So that's what we covered last time. I think the emphasis tonight is going to be on how to help students do the research, learn more about the economic findings, and analyze those themselves.
That's definitely a problem, is not only the amount of information that's coming out, but also the amount of disinformation that students and really everybody has to sift through in relation to this pandemic. And it's probably going to be a lingering problem for issues to come. So with that, I'm going to ask Mr. Lefebvre, you've authored or co-authored a bunch of studies. What are your general thoughts about approaching research and writing projects, and also keeping in mind the amount of research that's come out with the pandemic and COVID, how students can better navigate that?
Well, first of all, you have an opportunity to do very rewarding work and work that's also very hard. On the rewarding side of the equation, you have an opportunity as young researchers to discover something new, something missed by other scholars, an argument perhaps overlooked, or actually bring new data or calculations to the table that had not yet been discovered. The fact that this is a Michigan-specific essay almost clears the field for you. There has been some Michigan-specific commentaries on the subject, and I suspect there's more in the pipeline. But the fact that this is a Michigan-specific research question that you're looking at suggests that there's something really original opportunities are available to you. I can't stress enough how invigorating it is to add something new to the stock of knowledge in the world. And I hope that students will keep that in mind as they approach this particular research question at a time that's really, unprecedented. It's been a century since we've suffered a pandemic like this, and it has created really an undiscovered country of possible research subjects.
In reference to that, then, is there any specific advice that you would give for doing a research project on the pandemic and the Michigan economy in specific?
Yeah, a great deal of it, actually. In fact, I brought a slide and some ideas for students to work with going forward. If you could go to slide 3, please. Once you had your research question determined, it's important to just dive right into the scholarship that's available to you, because there are a lot of bright, energetic, ambitious minds out there, just in the academic universe alone, that have incentives, economic incentives to produce quality scholarship fast, questions of the day, very topical ones that will draw the attention of peer-reviewed journals and other scholars in your field. So as early as May, studies were being published on the website of the National Bureau of Economic Research that were new and involved the pandemic and its economic consequences. Now, I would recommend finding those in other pieces of literature by going right to Google Scholar. It's a terrific resource that's available to scholars today that wasn't when I started my research career. With a few key search terms, you can bring up many, many links that will help inform your more original thoughts and research. I spent just 2 hours starting a literature review in preparation for tonight's event. And you can see my spreadsheet on the screen. This is how I like to catalog my findings. For a previous study on Google Scholar alone, I was able to sift through some 1,000 links to narrow the field. And once I've narrowed what I wanted, I added them to the spreadsheet. You can too. Incidentally, in the first 2 hours, I found 9 studies that might be useful to your own research topic. And they actually covered some of the ground that Dr. Matchik has mentioned. One is on the long-term income impact of closures of schools on high school and college students. And I'm sorry to be a spoiler alert, but the results were negative. There was a very intriguing study that looked at county versus state data, and they found that counties with a lower share of GOP voters were more likely to live under some lockdown or find a lockdown acceptable. Then there was the study that Dr. Matchik has already mentioned, where they used anonymized cell phone data to track movement to 2 million businesses across the country before and after the pandemic. And they determined that something like only 7% of the unemployment that resulted after March really was a result of forced shutdowns and not from people changing their behavior when presented with information about a pandemic that was having some very significant consequences. And that list goes on. I stumbled into many others. In fact, there was one link I found, and I put it on the spreadsheet, that some 30 studies that found shutdowns to be ineffective or barely effective. So this is a great tool, and it's not the only one. You could also go to your university library and use the search functions there, digital ones. Eco and Econ Lit will also allow you to do keyword searches, download important papers that you don't find on Google Scholar. One word about my spreadsheet. It's very easy to summarize the data. So you put in the title, where you found it, the date, a quick summary, and you can refer to it as you're building your paper. I also have a column for citations, which is kind of important because you'll want to look at the quality of the work, and sometimes you can find the quality of work by how many other scholars have cited it.
That's quite a bit of information. So I guess the follow-up to that would be where's the starting point? Where's the very first resources that students should kind of consult, start gathering in that data?
Google Scholar. You don't have to leave your bedroom to go to Google Scholar. It's prominent on their website, and you can always Google it. And they've been archiving scholarly research since very early in the company's history.
I wonder if we should mention that some of these articles that they find will have paywalls or something like that. Most of the stuff that I think Michael has referred to tonight, and much of what I've seen, won't have those kind of obstacles. But of course, every once in a while, you see a journal requires some kind of payment. A lot of times, if you have access to an academic library, if you're a college student, Northwood, or high school student, you could maybe make use of your public library. They can get access because many libraries do have access to those journals. You can't get them as a private individual.
And the reason that many of these journals don't have paywalls yet is because they're still working papers. It's still so early in the pandemic and the studying of it that they're working papers and available for free. Once they reach the peer-reviewed journal publication stage, they're about $40 each.
Wow, that's definitely good to know. I think my next question is directed for Dr. Matchek. So students will obviously be investigating primarily the economic effects of the lockdown. What does that question mean to you, and how would you go about finding an answer to it?
Okay, so it's kind of a pet peeve of mine that there is a false dichotomy presented between, let's say, public health and the economy, or human lives and the economy. The economy is an abstraction, but what does it actually refer to? It refers to people going about their business in daily life. And so another way of thinking about this question is, how did the pandemic affect the way that people go about their business in their daily life? How did their lives change? And some of that can be measured, sure, by changes in their income, changes in employment, and so forth. But we shouldn't neglect other effects, so-called non-market effects, because these are also things that people value, like their mental health, their education, or their progress in school. And some of these things that happen are measurable now, and some of these things that happen will have effects far into the future. So just as an example of how this is the wrong way to think about, it's lives versus the economy. One of the things that has happened, people's behavior, is they've stopped using routine medical care. And that includes things, or they did stop medical care. And that includes things such as mammograms. And a mammogram is a very, very important preventive service. If you detect cancer early, you've got a much better chance of surviving it. We have cases, not here in Michigan, but around the country, where vaccines were delayed because the kids were not in school. And there are many terrible childhood diseases, mumps, measles, rubella, that are much more dangerous for kids than is COVID. So, Mr. Lefebvre already mentioned that there's some long-term consequences associated with your education and graduating during a recession. And these are the kinds of things that you can't measure and won't be able to measure for a while. But all of these very real consequences for human beings are part of what I think of and what economists think of as the economy. So I don't recommend that you focus solely on things like unemployment rate, income. Broaden your search to include other things like doctor visits, mental health, and think, even if it's not measured, it might be something important. Here's a chance for you to use your imagination, right? Think of your own experiences. What happened to you and your friends and your family as a result of the lockdown? These things may not be measurable, yet these things might be important. So, for example, in my own life, I was prevented from visiting my 89-year-old father for months. Thankfully, because of technology, I'm able to do FaceTime and things like that. And we should be grateful for the free enterprise system, which gave us the technology which we've been relying on. But these things are difficult to value, and these are real impacts. To the extent that these things are necessary, save lives, they have benefit. But let's not forget the fact that for every benefit, there's a corresponding opportunity cost. What could we have done? The other thing I want to stress is that you're going to need a benchmark. So a lot of the times we immediately go to the benchmark. What would have happened if there were no lockdowns? But I don't think that's an appropriate benchmark. I don't think this was ever a case when the government was going to do nothing. So I think an appropriate benchmark, and you're going to have to be specific about this in your paper, might be, well, what could the government have done that would have protected people from infection while doing less damage, for example, to the economy? So what about a more targeted intervention where you try to protect those that are most vulnerable to the disease? Just as an example, I went to the grocery store once and found a 65-year-old cashier. I'm guessing they were 65. They sure looked 65. Well, they're an essential employee. Meanwhile, I go home and I get a check from the government to help me through the crisis. My income, my livelihood was not affected because I can easily work from home during the crisis. But this person working at the grocery store, living on a much lower income than I did, was kept on the job at high risk. I think a targeted policy to protect the vulnerable would have said, if you're in this group, then you should get a leave of absence from work, and maybe a government program should help you cope with your loss of income, rather than just throw money at everybody and keep people working regardless of risk. So think about what an appropriate public policy might have looked like and use that as your benchmark.
A quick follow-up to that then, and this is kind of, in reference to back when I submitted an essay for this competition too, is that, while this is focusing on the effects of Michigan itself, is it something to consider about, things like federal stimulus and the way that affected things just in the state of Michigan? Or can students also compare themselves to other Midwestern states and kind of see how their success with the pandemic compares to Michigan's? Are these appropriate ways of going about analyzing that Michigan question?
If I may field that one, Dr. Matchik, and I brought a slide. It's the number one slide on my slide deck. Yes, that's a very appropriate tool. Dr. Matchik has talked about having an ability to measure certain impacts. Not everything can be measured. It's very difficult to measure the utility that Dr. Matchik received or did not from seeing his father in person or online. But many of the metrics that are available to you are available by state now. And in the first slide that I brought with me, I show trend lines of 5 Midwestern states. The first one is Michigan. I would encourage you to ask yourself, is it possible to recognize from the trend lines alone whether or not particular orders from the state government actually mattered, and mattered in particularly important situations to lower COVID infection and death rates? This is a kind of a messy graph with all 5 states on there, but the information is available to the earnest researcher. It's easy to find on the CDC's website, and they even have a tool that will allow you to choose up to 5 or 6 states at a time. If you go to slide 2, you'll see that I've changed the focus to 2 different states instead of the 5 Midwestern ones to just include Florida and California. And I do that for the students because I want them to be able to clearly see the trend lines of 2 states that took different approaches to addressing the COVID-19 pandemic. Florida had a very light regulatory touch, and California had a very heavy one. Can you look at the trend lines and where they cross and tease out what policies may have been responsible for an increase or decrease in deaths? I mean, California was threatening to shut off the water supply to some building owners and homeowners if they had too many people that the state determined was in excess of what would be safe. These are questions that you could answer depending on and answer very detailed depending on your degree of sophistication.
I want to add one thing in case the students are not aware of it. The Chicago Fed does produce a Midwestern Index of Economic Activity, and there's information on there available to Michigan's contribution to that. So if you are specifically interested in data on Michigan, and especially Michigan's performance relative to the nation and relative to other states in the Midwest, Chicago Fed has something called the Midwest Economic Index, which you might want to look at.
Awesome. And then this next question goes to Mr. Lefebvre. And so you mentioned turning first to Google Scholar, and that we'll have a compilation of academic studies done by other people. But are there any sources of data that students can go and kind of do their own original analysis on and make extrapolations from that?
Yes, there's some excellent sources. One of the obvious ones would be the Bureau of Labor Statistics. There's the Center for Disease Control, which I've already mentioned. There's a place called, I think it's worldometers.info, which has a great deal of information, statistics on COVID rates and death, among other statistics, and an exciting web page where the data is real-time, anonymized, and free. And I believe it's called the Opportunity Insight webpage, and it is underwritten by the Bill and Melinda Gates Foundation with contributions from Harvard and Brown. And you'll not only find data there, but you will find some scholarly works that have been done using that data. It is not a pandemic and economics specific website, but it's very obvious they're using the data for that type of research. If you could go to my 4th slide, I'd actually like to show you something we created, a colleague of mine in Indiana created for me when we were discussing the impact of regulations in Michigan versus other states. He went to this Opportunity Insight website, downloaded data from Michigan and Ohio, and overlaid employment impact over time with the 2 states. And the reason that he chose Michigan versus North Dakota is North Dakota has probably had the 2nd lightest regulatory touch in the country in the last 8-9 months, and it was a good comparison to Michigan. You can see there at the October end of the data set that employment in North Dakota fell far more than Michigan, kind of a wide gulf. But early on, when stay-at-home orders were being issued, North Dakota was doing much better than Michigan, despite the fact that part of the shutdown, part of the economic impact was a result of people changing their behavior. And if there's time later on in this presentation, I'd like to go back and talk about just North and South Dakota. It's really a remarkable example. Today, there are 1 and 2 in infection rates and 6 and 8 in death rates, but falling, and not necessarily because of government edicts.
When you mentioned that, so have North and South Dakota more so kept open during the entire course of this time? Has there been any changes to that approach throughout the entire, past 10 months, or have they pretty much maintained the same stance?
Yes, in North Dakota, in the last quarter of the year, there were some regulations imposed on gatherings that other states had adopted long ago and in more stringent fashion. South Dakota has never closed a dining room. They've been quite open, and what's interesting is South Dakota even hosted a biker rally with 500,000 bikers in August. Uh, Now, you talk about people having a sense for the risk involved in the pandemic. Many of these bikers, they were quite comfortable enough with risk that they don't even want to wear a helmet, let alone a mask. So, what impact did that have in South Dakota alone, or wherever they went home to? That's a great question for future scholars to look at. Hopefully, they did not impose a lot of negative externalities from their lack of mask wearing, but I think that there's some stories coming out of North and South Dakota now that indicate because of the higher infection rates and death rates, people have become so much more sensitive to it, they are regulating their own behavior, and it's having a positive effect on reducing COVID infection rates and death rates as well. One more policy item, if I may. On my last slide, I actually brought in a graphic created by the Mackinac Center for Public Policy on its COVID-19 webpage. And what we did was we tracked COVID deaths in Michigan over time and then superimposed policy changes and those specific dates on top of it. It would be good for the earnest student to look that over and ask themselves, is there a way to find an inflection point here, whether it's more COVID infection rates or less, before or after mandates to stay at home, or a lifting of certain mandates like not going to school versus going back to class?
This is a pretty good indication of the way that economists are investigating to try and figure out what the effect is in any particular state. You kind of need a control group, and it's good to have as close as possible similarity between those two. So that's why a lot of the information you're going to find probably compares states that are quite similar in certain respects. California has Disneyland, Florida has Disney World. Disneyland shut down, Florida stayed open, right? That's the kind of studies that economists are doing. One of the most interesting ones I saw looked at a metropolitan area on the border between Illinois and Iowa. And that looked at very micro, fine level data, try and determine whether or not Iowa, which did not have a lockdown, had any better results than Illinois, which had a lockdown, and they could not find significant impact. So those are the kinds of studies. Now the question is, can you take the results of a study like that and extrapolate that to Michigan? And I think you can probably, without stretching it up too much, you can probably use those studies to support or to make an educated guess about what the effects were in Michigan. If you can find specific industries that are important to Michigan that were maybe disproportionately hit by the lockdown, I think that would be. So Michigan, our tourism industry, fishing, things like that might be particular to Michigan, and we might not have a comparable state to compare that to.
Sure. And building off of that a little bit, do you think that the lockdowns were, worth it? And then with that, can students go ahead and talk about the positive effects of the lockdowns and kind of weigh that data with the negative effects of them and compare, some of the things that created good outcomes in relation to social distancing, culture, things like that, perhaps, when they're going about this essay?
Well, I would argue that they have a responsibility when they conduct a literature review to present, a summation of that literature, whether it bolsters a case you thought you were going to end up with or not. Some of these studies say that the shutdowns were effective. Some of the studies say that shutdowns were responsible for 50% of the unemployment associated with the overall pandemic. You've just mentioned a great cross-border study, and there's another one published in November comparing counties across state borders, but separated by one row of counties. And they found that the lockdowns were cost-effective in terms of mask mandates and even removing indoor dining from the equation. However, as you went down the list of vital businesses, it became actually counterproductive. They said closing schools was a counterproductive effort. All of this should be factored into your paper. And when you tell people what you're going to tell them, when you're setting them up, this is a great place to use that data.
John, I think question of is it worth it, again, it gets back to the benchmark. Compared to what? So I think there's no doubt that some of the government interventions did save lives, and you will find that in your research. So the massive saved lives, closing bars probably saved lives, and then did closing golf courses save lives? I'm not sure about that. So the question is, compared to what? Compared to a targeted policy, we might have had an increase in lives saved. Now, Mario Cuomo, the governor of New York, said something which I think moved a lot of people. And he said, if we save just one life, it will have been worth it. So he set the standard. If the lockdowns save even one life, they're worth it. Now, that's not a standard set by an economist, because obviously for every life you save by restricting the spread of COVID, there are other risks that you're introducing into the economy. There's something that economists call deaths of despair, associated with high rates of unemployment, hopelessness, loneliness. And this leads to substance abuse. People who have long periods of unemployment are at risk for a whole host of life-shortening conditions. And so there's been estimates that I have seen that the net loss of life, what I might call the generalized risk, that was unnecessary, caused by unnecessary increases in unemployment, isolation, and so forth, that's costly. So Governor Cuomo is wrong. What we want to do is save lives, period. And that means looking at everything that your policy might potentially impact with regard to public health. I also want to mention one other area which you will probably come across in your research and which I think is very important. And this has to do with the distribution of the benefits. Who bears the costs? Who bears the brunt of them? And in that story I told you about the grocery clerk, that person bore most of the risk. And there were many people in lower middle incomes or living near poverty that lost their jobs during the pandemic and will have a much tougher time getting into the labor market during the recovery. Long-term businesses are finding ways to get by with less labor. They're making substitutions for more capital, more automation. So there seems to be some long-term consequences that fall more heavily on the poor.
At last week's or the last event, someone quoted Thomas Sowell, who said, "There are no solutions, just trade-offs."
I believe that was Dr. Matchek that quoted that. And then, so a quick follow-up too. In addition to finding and reviewing data, is there a particular method or direction in which you'd recommend for students? Is there a certain methodology that would make their interpretation of that data more successful than others?
When it comes to writing a paper, I would recommend starting with the end in mind. What's your research question? What is your goal? And then work backwards with not only critical dates, but the vital tasks that you have before you. And I think I mentioned briefly that some of the paper and research that are going to be submitted, the level will depend on the experience of the student. I'm not expecting a high school student to be proficient in Excel or a stats package and be able to download BLS and other data and make rates of change calculations or even do a regression analysis. But if they could, if that was their degree of sophistication, then my recommendation would be to do just that. If you have those tools at your disposal, look at COVID deaths in Michigan, look at shutdown orders or times when those were lifted, and try to tease something out of the data and add something new to the discussion. High school students can still make a new contribution by doing a large survey of the literature and making their own case based on that literature review. You might find a new angle, and you might find new research or data that supports your thesis.
And I don't know if it's useful to you, but when I do a research topic and I'm surveying the literature, I don't know what I'm looking for to begin with, but patterns do emerge. And so I often, and this probably says something about my age, but I often use index cards. And as I come across a new bit of information, I make a note on an index card. And as I find something else on that particular topic, that goes in a pile. I have maybe 5 or 6 piles of index cards. And then when I'm ready to write it up, I've got 5 or 6 different sections of my paper. And I find that can be effective when I don't actually know what the structure of my paper will be in advance. I agree, you begin with the end in mind. But if you're just exploring the data to begin with, keep a record of everything you find and try and look for patterns. The other thing that I would recommend is don't get discouraged because you come across research you don't understand. Most of the research papers I read, I'm embarrassed to say, I don't read the middle of the paper. I read the introduction and I read the conclusion, and that's usually where you'll find the most clear and most important results from that particular study. So you can get through a lot of literature very quickly and with a lot less tears if you read the first and last paragraphs.
Well, in the interest of time here, I think I'm going to move to some of these audience questions because there are a couple good ones here, and I think we might spend a decent amount of time talking about them. So Jessica asks, can we focus on specific industries that were affected and specific policies related to them to have our research hone in on a specific issue as a result of all of this, or should we be more general? Having had done one of these research papers, I can say personally that I think focusing on specific things and doing them more meticulously is definitely an advantage. I definitely think that you know, having very specific items and being able to prove beyond a decent reasonable doubt that your conclusion is probably a lot more effective than just saying general statements. But I would like to hear both of your opinions on that as well.
Well, Dr. Matchik actually mentioned one industry, and that is of the tourism industry that a couple of scholars have already picked up on and other writers because it's something of the canary in the coal mine for the impact on Michigan's economy. We do have a tourism economy here, so this is where the data may show you big inflection points first. And specifically, you can look for the accommodations industry in official government statistics, and they'll cover hotels, motels, bed and breakfast, maybe even RV parks in a subset of categories, as well as physical lodging, like a log cabin. And that data should be available by the government for several quarters by now, which will give you a nice, I think, rich enough data set. Some studies that are being done already just use 2.5 months. You should have 3 quarters, 3 full quarters.
And by the way, we use the word data, and most people, their mind immediately goes to numbers, and that's appropriate, statistics, aggregates. But the stories of individuals is also data. And if you come across news articles where somebody is interviewed about their business, or there was a court case that focused on a particular business and what happened to the owner when they tried to stay open or something along these lines, that's also data. A quotation from that person might lend powerful support for a particular point of view. Yeah, it's anecdotal, and for that reason, it might not have the same validity as a number that surveys 100,000 businesses, but it still lends a kind of support. And it also adds, for the reader, human interest element to your essay that I think many readers will appreciate.
I think that human interest and perhaps even a level of storytelling element is worth driving home to a good degree. For how I structured my essay last year, the prompt was in relation to Michigan regulation. And I pretty much started telling a story about a lot of the constitutional changes that happened over time that kind of allowed for that regulation, and then use that as my jumping off point to get into the data. Additionally, I also interviewed a lawyer about the regulation of the emerging marijuana industry. And I think that qualitative opinion on somebody who's an expert in the field was helpful to that as well. So, for students out there that are doing this, things worth considering. Obviously, don't know who the judges will be and have no idea how this will, be assessed and ranked, but definitely things worth considering is that all those things can at least, make your submission more unique by adding those kind of components than just going through, data analysis and hoping that you have the best data analysis out of everybody.
That human touch is a great opening hook, too.
Yeah, absolutely. I think I left most of those in kind of the introduction and the conclusion of the paper, and then allowed the data to kind of speak for those things for the most part. Another question: any findings on the long-term economic impacts of the created psychosis, the way people view strangers as a biohazard instead of potential friends, business partners? Is that something that you can kind of look?
That's a great question. I think that the way we talk about COVID is in itself a public policy. So when somebody in authority talks about COVID and the risks of COVID, and they're supplying us with reliable information that we can use to stay safe, I think that's an excellent public policy. If people, scare us into thinking that, the slightest interaction with our friends and coworkers is putting us at terrible risk, I think that's also a policy and a potentially destructive policy. So I can't tell you that there's any way to quantify, apart from doing an actual direct survey of how this has changed people's interactions with their coworkers, with strangers. But it's a great question, and it's worth speculating about.
It is a great question, and one that lets us come really full circle to some of the things we started talking about earlier, and your mention of watching themes emerge from the literature. There's 5 or 6 studies out there where I've noticed the theme of people self-regulating their behavior. It's the risk homeostasis angle. Some of us like to parachute, other people like to hide in their basement for fear of having to say hello to someone else. So that information that government can provide, especially at a local level, can help bring a more nuanced approach to fighting the pandemic while keeping economies in better shape than they otherwise might be.
Yeah. Another thing, by the way, I should just caution people. If you're just looking at raw data on deaths and let's say business closures or something like that, causation works both ways. So, be pretty explicit in what causes what. If there's an area where there's a local outbreak, well, yeah, people are going to change their behavior, and there's going to be a lot more, a lot less economic activity there. So, just a little note about causation, correlation, not necessarily causation.
To build on that, then, is there reason to maybe even talk about the cultural effects as a potential, economic consequence of not only treating others like a biohazard, but also the idea that, remote work is going to be much more popular in the future, most likely. And the way that we go about doing business and the, things that we see people for might change permanently. Are those considered economic effects that people can kind of, at the very least, project at and kind of see how that's going to matter, a few years down the line, maybe even a decade down the line?
There's been attempts made already because people are speculating that many knowledge workers who used to go to an office not only like where they are, but their boss is saving on rent money and for buildings, and finding that their employees are as at least as productive as they were at the office. Some things do change that aren't that it might still be a net positive, but there are still negatives, such as the social interaction and hallway conversations that occur that make an institution more efficient than it might otherwise be. That is often lost, and one of the reasons I think that just one of the reasons that Zoom and Blue Jean meetings are so popular, or should I say popular in quotes.
Going to be more popular in the future, or are we getting tired of them as time goes on here? That might be something worth considering too.
I'll tell you, I do think these are real economic effects. The word that economists use to describe these effects are they're structural changes in the economy. The way we do things is going to change permanently, and remote work is one of those. I think if I were a real estate speculator, I'd look at the nice places to live and I'd start buying homes there, because people are going to find if I can work from anywhere, I might as well work from somewhere pleasant. And if I owned a home in Silicon Valley, I might put it on the market, because I just don't think there's a need, as it used to be, for people to be in physical proximity. So these are structural changes to the economy. They're real economic effects. These cultural changes, to the extent that they're permanent. But one of the things that bothers me a little bit is the political effects that might be long-term. There seems to be tolerance in America right now for rather draconian responses to public health threats. And to the extent that this has established a precedent now, can we expect more of these, I think, highly restrictive, untargeted, general kinds of public policy responses to future public health threats, or perhaps terrorist threats, or anything like that?
There's an expression that goes, if you have a hammer, every problem looks like a nail. And unfortunately, people have seen government responses and simply tracked reductions in rates of COVID infections and death after it happened. Well, B follows A in the alphabet. That doesn't mean A caused B to happen, but even if it did, it probably gave them some reflection of the government doing something and creating the appearance of success, which would make them more comfortable for the next heavy-handed action.
Right, and I think to the extent that the public buys into that narrative, public support will be there.
Mm-hmm.
Awesome. One final question before we start to wrap things up here, and this is just a personal one that I have, is there's been a lot of controversy about stimulus, and I believe this was one of the most expensive. 2020 was probably the most expensive year in the history of American government. Is that something that students can factor in and kind of talk about things like the monetary effects that this has? How people go about spending because of that, the effects that too much stimulus has had on employment, just kind of all of those extra additional factors that again are more so federal decisions, but definitely have very dramatic effects at a state level.
Yeah, the question is framed the effects on Michigan, but anything that happens fiscally at the national level is going to affect on. So it's not out of bounds to talk about the stimulus package, although it's not quite part of the lockdown. It was motivated in part to make the lockdowns more tolerable and help people survive economically during the lockdown. So I definitely think that the stimulus is fair game when talking about the economic effects of the lockdown. And I agree with you, John, that the debt that we have now, already before this most recent stimulus, had exceeded the debt to GDP ratios that we saw during World War II. And there is no fiscal discipline right now in Congress. They're not saying, well, we're going to cut back on these other ideas just because we've got the debt to deal with for the next few years. They want to continue with a fairly ambitious agenda, and that worries me. After World War II, there was a concerted effort, and this is something I think Eisenhower should get more credit for, to get the debt down to a manageable level. For young people, especially, this should be an issue of concern.
Absolutely, I completely agree with you. And the budget impact in Michigan has already been measured. We had a slight decline in the last year-over-year numbers for state revenues from state sources, but that was more than offset by what came down from the federal government. In fact, I think the feds have increased our state budget by $10 billion in the last year or two. And frequently, once that spending starts, there is a narrow constituency born to keep it at that level, or a new program born. And I think we're going to see part of that play out right here in Michigan again, because this is not our first experience with the stimulus package.
It's worth being cautious of maybe even bubbles that are being created as a result of that, especially as that type of spending continues. Well, I think that pretty much wraps things up here. I'd like to thank both of you very much for taking the time to do this and having some great answers. And I'm sure that any students that are watching right now will find those resourceful, absolutely. And I'd like to thank everybody that took the time to watch this discussion. Obviously, most of this discussion was in the interest of the 2021 Bauer-Vick essay competition. So definitely make sure that you are staying on top of that and preparing for it as things go along here. Additionally, you'll be able to find this discussion on the Mackinac Center for Public Policy's website, and you can also check their website for future events that are coming up on topics like COVID and a plethora of other topics. They do really great work there. All right, might have just cut out for a moment there. Yeah, if there's anything that the both of you would like to add before we close out here, feel free.
I just want to thank the Mackinac Center for participating in this. I want to thank any of you who tuned in tonight, and I know that you're going to produce some good work, and I applaud you for the effort.
Thank you, Dr. Matchik, and it was good working with you again. And I hope that students visit the COVID-19 webpage that the Mackinac Center has set up. It's got all our COVID-19 specific stuff, and there's more in the pipeline. So please keep your eye out because it's Michigan and economic specific.
Thank you both. Appreciate it.